Imagine getting a call from your pediatrician's office, and they mention something about your child's recent lab work. Suddenly, you are faced with a sheet of numbers and medical terms. It can feel a little overwhelming, right? Making sense of pediatric test results really comes down to a few key strategies. Understanding the basics of what was tested, knowing what normal ranges look like for children, and most importantly, communicating effectively with your pediatrician. The core mechanism here is that every test measures something specific in your child's body, like blood cell counts or electrolyte levels. These measurements are then compared to established normal ranges that vary based on your child's age, sex, and even their current health status. Pediatricians are experts in interpreting these nuances because a child's body is constantly growing and changing, which affects what is considered normal. So, how can you proactively make sense of these results? First, always ask for a copy of the results for your own records. When you review them, look for the test name, the numerical value, and the reference range. The reference range is the normal spectrum, and anything outside of it is usually flagged. Second, prepare questions for your doctor. Ask what each test measures and why it was ordered. Inquire about the clinical significance of any flagged results. For example, is a slightly high white blood cell count a sign of infection or a normal response to something minor like a common cold? Third, confirm if any follow-up is needed. Sometimes, an abnormal result might simply mean watching and waiting, while other times it indicates further investigation or treatment. Do not hesitate to ask your pediatrician to explain any terms or numbers that confuse you. They are there to help you understand. A powerful insider detail to remember is that pediatric reference ranges are often much narrower and more specific than adult ranges. What might be considered normal for an adult could be a significant finding in a child. For example, a minor fluctuation in blood sugar in an adult might be easily dismissed, but in a young child, it could warrant closer attention due to their developing metabolic systems. Understanding the concept of age-appropriate normal ranges empowers you to have more informed conversations about your child's health. Another interesting fact is that some tests, like a rapid strep test, provide qualitative results, meaning a simple positive or negative, rather than numerical values, which simplifies interpretation considerably. By taking an active role in understanding the tests and communicating openly with your pediatrician, you transform from a passive recipient of information into an informed advocate for your child's health. This proactive approach helps reduce anxiety and ensures that your child receives the most appropriate care based on a clear understanding of their unique results.